Good afternoon and welcome to the May 2024 Pitt County Department of Social Services Board meeting. I would like to call the meeting to order and start by having a moment of silence. Thank you. Roll call.
And we have one member that is absent, so we will need to have a motion to excuse her.
Which one is?
Miss, yep.
Colleen.
Mhm.
Can I have a motion to excuse Ms. Colleen Dibble?
So moved.
Second.
Second.
Thank you. Is there any changes to today's agenda?
Move to approve.
Second.
Thank you. Do we have any public address for the board?
No, sir.
Thank you. You all should have received a copy of last month's minutes. Are there any changes to last month's minutes?
Only thing I see is a date change.
Which one's that?
The minutes. Says March instead of April.
On the top? Yes, ma'am.
All right, that's it.
Any other discussions? Can I have a motion to approve?
So moved.
Thank you.
Okay.
Next, we have recognitions by the director.
Good afternoon, everyone. When I call your name, if you could just step forward, come over to the podium, make sure that you adjust the microphone and introduce yourself and tell us a little bit about yourself and what your position here is at Pitt County. Our first new hire is Nikki Bell. Welcome, Nikki.
Thank you. Hello, everyone. My name is Nikki Bell. Good afternoon, everyone. I'm here coming from ECU Medical Center. So over there, I was trauma support team. So work with the public quite a bit in their most vulnerable times. So, and even like this place, it's sort of the same thing. You know, people are very vulnerable. So
Welcome.
I appreciate being here. I thank you all. See you around.
Okay, thank you.
Welcome aboard.
And Kayla Daniels. Okay, I guess Kayla was not able to join us this afternoon. Clerk Jana, do you know what area she's from? Do you know where she was hired?
Daycare and home services.
Thank you. All right. We have some recognitions this month and a proclamation. And so, Ms. Rhonda Dawson, if you'd like to step forward for me. Come on down. So, for those who may not know, May is Foster Care Month. And just to talk to you a little bit about our foster care in Pitt County. First of all, we have absolutely magnificent people that work in our permanency planning unit. And their job is, when children are placed into foster care, either to reunite them with their families, or if that is not possible, to look for a forever home to children. And so they work very hard. They work with biological families, the foster families, work intensely with our youth to make sure that they get what they need and that their needs are met both in a loving and a caring environment, as well as things like clothing, food, and shelter. So as I read this proclamation, I just want you to think about where these young people are in their life and the traumatic events that maybe have led them here, and how they're able to not only survive but thrive. So, in proclamation of recognizing Foster Care Month in May 2024, whereas the youth of Pitt County are our most precious resource and hope for the future, and all children deserve a safe, loving, and nurturing place to call home. And whereas there are approximately 165 children and youth in the foster care system and approximately 26 young adults ages 18 to 20 in extended foster care in Pitt County. And whereas the purpose of foster care is to provide temporary, safe, secure, and stable homes through the compassion and nurturing of a foster family or kinship family. And whereas the foster families and kinship families open their homes and hearts to those children whose families are in crisis and play a vital role in helping children and families heal and reunify while launching children into successful adulthood. And whereas we encourage Pitt County citizens to think about how they can help meet the needs for more foster, kinship, and adoptive families. And whereas Foster Care Month is an opportunity to recognize the foster parents, kinship families, child welfare professionals, advocates working to ensure children's safety, permanence, and well-being, and to spread awareness on behalf of all the children in foster care in Pitt County. And whereas Pitt County encourages residents to volunteer their time, energy, and talents on behalf of children in foster care and their biological families, kinship caregivers, and foster parents during this month and throughout the year. Now therefore, be it resolved that I, Sharon L. Rochelle, Director of the Department of Social Services, do hereby proclaim May 2024 as Foster Care Month in Pitt County and commend its observance to all citizens. Thank you, Rhonda.
Thank you. Ms. Bell, you're welcome to stay, or you can be dismissed. Next, we're going to have a department spotlight.
Yes. So, Rhonda, if you could step forward. Since it's Foster Care Month, we would like to spotlight our Permanency Planning Department.
Good afternoon, everyone. Ms. Rochelle asked me to come and speak and basically brag on foster care, permanency planning, and all the work that we have been doing. We'll try and remember to do the clicker. So, I wanted to start off by giving y'all some statistics and just seeing where we've come in the past few years and where we're going. So in 2022, as we were still in the middle of COVID, we had 102 children that entered into the department's custody, with 66 of those children leaving. 15 of those children received guardianship with a relative, 12 were adopted, 7 had guardianship record approved, 13 aged out, and 12 were reunified with their parents. And 3 were given custody to the non-removal parent, meaning it was a parent who was not deemed to have neglected their child. Moving into 2023, our stats are a little bit better. We had 86 children that entered into foster care and 74 children left custody. During that time, we had 16 children that received guardianship with a relative, 4 guardianship with a court-approved caregiver, 8 were adopted, 17 were reunified with parents, an additional 3 custody with non-removal parent, 1 was a custody with relative, and 10 children aged out. And now we come to 2024, and I feel like 2024, my folks are rocking it out pretty good. So far, we've had 19 children that have entered custody, and thus far this year, we've already had 25 children leave the custody of the department. And thus far with that, we've had 4 guardianships with a relative, 4 guardianships with court approved, 6 adoptions, there's a typo, 8 were reunified, and 3 have aged out. So we're on track. We have approximately 15 children that should be free for adoption this summer and should be headed towards adoption prior to the end of the year or the first part of next year, which is a great bonus when we look at our adoption numbers and the money that we can pull down from the feds for the number when we meet our goal. And just so you're aware, we currently have 165 children in the department's custody. Of those children, 39 are birth to 5, 6 to 12, we have 55 of those children. And our 13 to 17-year-olds, we have 71 of those children. So we're seeing more of our teens continuing to be in custody. And those teens would most likely be the ones to age out of the department. With that being said, it makes our 18 to 21 program and our LINKS program even more valuable. Our LINKS work starts when the children are 13. And that's when they first become eligible to start working, and they have a transition living plan. And they start working on goals and start looking at things that they want to do as they grow up and things like that. And they're eligible to participate in our monthly meetings that we have, that Shantae Carson does. Every month is a different meeting. This month is how to travel on a budget. And I was like, maybe I should attend that as well. But she does a lot with money management, resume building, how to write a resume, have people come in about references and looking at apartments. Just a lot of valuable things that youth growing up need to know today. And we currently have 26 youth that are in our 18 to 21 program. And we're expecting in the next 6 months to have probably at least 11 more become eligible for that program with aging out of regular foster care. So we have one LINKS social worker and one 18 to 21, and they work very well together to, help get our kids ready to be into the world and adults. Okay, our foster homes. Obviously, we couldn't do this work without our foster homes. We're planning this year to complete 2 trainings in an attempt to obtain more foster homes. Because all of our homes are full. What happens is our foster families, they take these kids in and they love them and they bond with them and they become their parents, and they end up adopting kids and getting guardianship of kids, and then they close their licenses out because the state of North Carolina says you can only have 5 children in the home, and that includes the biological children plus the foster or adoptive guardianship kids. So unfortunately, some of our homes we can't keep forever. Wish we could clone them, but that's not what we're allowed to do. So, but right now we currently have 23 licensed homes. And just to break down our program is a pretty big program with a lot of different areas and things going on. We currently have 4 supervisors, 8 foster care workers that only do foster care, 4 adoption foster care workers, 2 foster care licensing social workers, 1 social worker that is only licensing and placement, an 18 to 21, a LINKS worker, and a transition social worker. And their job whenever children first come into care is to help bridge that gap, to help make sure beginnings paperwork gets done, so security, Medicaid changes, all those things happen whenever a child first comes into care, just to kind of be that bridge. I think at one of the meetings, they talked about how they've had about 100% turnover. We're not quite 100%, but out of all these, my social workers, 13 have 5 years or less experience in foster care, with 9 of those having less than 1 year. And they're coming in to having close to a standard caseload after they complete pre-service, just because of the volume that we have right now. And the standard caseload is 15, and everybody's right now around 11 to 13 cases. We do have 1 social worker that has been here 20 years, and we have another almost 17 years, and several that have been here just over 5 years. So we're rebuilding, but not to the extent I think some of the other programs have had to rebuild. So, and partnerships. I put the child in the middle because essentially that's what we're here for, is the child. But in working for that child, we have to make partnerships with so many different areas in the community, with families, mental health providers, placement providers. We build lots of relationships, and those relationships help us tremendously at all times. It helped us Friday night at 11 o'clock at night when we had a disruption, and we were able to call a provider for a child, and they took that child for us, which was able to prevent us from having to be here over the weekend and Mother's Day, because we build those relationships with our community partners for these children. And that's pretty much it. Does anyone have any questions?
Any questions?
We have a lot of programs and a lot going on, but Miss Rochelle has been really great in working with us to help with our ideas, to keep us from having, knock on wood, to stay in the agency, and with working with some of the difficult youth that we do have in our care that we're charged to try and help now.
Rhonda, could you just talk a little bit about when's the last time that that all of you folks had to stay here, and just some of the creative ideas that you've come up with to be able to get kids placed someplace as opposed to staying here in the agency?
We haven't stayed here at the agency in over a year, which if you talk to other counties cannot say that. We have worked really hard to partner with what's called the B3 respite homes and respite providers to work with us. We do our own checks as well. And we also get the home sanction, because that's another piece that we're supposed to do if they're going to be there more than 3 days, I believe it is. No, more than 14 days. Then we have to have a home sanction by the court. So we work really hard and really well to try and get with our legal team as well in order to get those homes sanctioned. Right now, we currently have 16 youth residing in respite homes. And these are tough kids. These are kids that are meant to be in either level 3 group homes or our psychiatric residential treatment facilities, which are locked facilities. And they aren't able to get into those programs due to behaviors or just the lack of availability. And these individuals do really good work with these kids, and sometimes have their houses vandalized by them. They've had cars stolen, but they still, even though it may not be that child, but they still come through to help us with the youth from the relationships that we have built.
Okay. I would like to know more separately about the links, workforce readiness and preparation.
Mm-hmm.
We can do that on the side.
Okay.
But I'm interested in that.
Okay. Anything else?
Thanks for all y'all do. I know it's difficult
Well,
work.
we do,
But rewarding.
as somebody said, foster care is a lifestyle because we constantly come together to get for the common goal for that child. When I got called the other night, it wasn't just me. It was one of my supervisors, and we're on the phone, we're tag teaming, just doing those things to try and make things happen. So it very much, I would say, foster care is a lifestyle.
And Rhonda, for this coming year, I know we talked a little bit about the potential adoptions that are going to take place. If you could just talk a little bit about what our numbers look like.
Well, so far, our numbers, we have already done 6 adoptions this year. The goal is to get, our baseline is, I think, 11. And hopefully our goal, we're going to surpass our baseline. We've got several TPRs pending, termination of parental rights. And we've also got 6 that are in the, that have already had their termination rights done. So now we're just going through the legal process for the adoption piece. So potentially we will have 15 plus adoptions completed prior to the end of this year. which is going to put us above our baseline, so.
And I think the awesome thing about, I would like to go to more, but I was able to go to one of the adoptions, and to see the fruition of all this good work that's gone on, and seeing a child who participates in the adoption process actually be part of it. And I don't know, it was like just the most heartwarming thing. And then to walk away with their forever family. So it's hard. There's a lot that goes in from the beginning of a case until that point, but I think it's when you see those days come that it's just wonderful for the children, and wonderful for our workers to be able to see that happen.
Yeah, the youth that I think their adoption is being finalized this week, is actually being adopted by his sibling, who had previously been in the system. And as she has aged out, become an adult, solidified herself in the community, she's taken on and worked to get her siblings.
That's great.
So,
Well, Rhonda, thank you and all your
Thank
staff
you.
for the wonderful
thank
work.
you.
Thank you. Next, we're going to have items for report, economic services update.
Good afternoon. I'll start with the low-income energy assistance report. That information is in your packet. The application period closed at the end of March for the low-income energy assistance program, and in your packet are the March 31st ending reports and April 30th. So this is the final report for the LEAP season, ending April 30th. We had assisted 3,405 households with heating assistance, and the amount of assistance provided was $1,251,700 for the 2023-2024 LEAP season. I'll move into the Medicaid applications report. During the month of April, we received 984 Medicaid applications. That was an increase. In the previous month, we had received 799. During the month of March, we processed 1,183. During the month of April, we processed 1,155. So as of May 1st, we have had 1,950 Medicaid applications pending. The Medicaid report cards for March and April are also in your packet. The disability applications, our timeliness for the month of March was 79%. And the other category, which is all other Medicaid applications, 52% applications processed in March were processed timely. The report for April, disability applications, timeliness processing was at 82%, and the other Medicaid category, 52% processed timely. The other Medicaid category is where all of the applications, the majority of the applications coming through with Medicaid expansion, that's the category where we are so far down in our processing. We are working, Ms. Rochelle is working with us on securing some supplemental staff, since we do have vacancies we're filling, and we also have a lot of people in training. We will be using a staffing agency that specializes in economic services programs, and they've already identified for us staff that have experience in the Medicaid program that will be able to start working with us without having to have a lot of additional training. So that's the plan that we're working on for helping reduce the number of pending applications and to get back on track with our timeliness processing in that program area. On the Medicaid applications report, you can see that the number is going down, but it's going down very slowly. And we will continue to receive a high volume of applications for a while, as people are still learning about the newly expanded Medicaid program and making application. Also included in your packet is some information from the Medicaid expansion dashboard. This was the most recent information we have as of April 4th. As of April 4th, statewide, 416,595 people are now receiving, as a result of Medicaid expansion, full Medicaid coverage. This shows, I've got the pages that are inserted have the numbers for Pitt County. It's interesting to see that as of April 4th, 8,012 individuals in Pitt County are now receiving full Medicaid that either previously were not receiving in any Medicaid program at all or were receiving in a lesser benefit program. And the number predicted through year 2 for Pitt County, the projection was 12,800 individuals. So you can see from December, when the program opened, to April 4th, we've exceeded 8,000, so that's a positive. I'm happy to answer any other questions you may have.
Have any questions for Brian?
Questions?
Thank you, Brian.
Thank you.
Next, we're going to have the director's report.
So my director's report is fairly short. I was able to go in front of the Board of County Commissioners and present our budget, ask. We were the first department to go, and Catherine was there, and I think it went pretty well overall. And so we're just really waiting to hear when the budget becomes finalized. I also just want to update you. I'm going to try to do this every meeting so that you're aware. I just got the numbers from my personnel tech, but just to let you know where we're at. Right now, we have 44 vacancies, and I'll break those down for you. So in economic services, we have 27. We have 7 new hires in progress. In adult services, we have 2. In child welfare, there are 11 vacancies with 4 new hires in progress. Family support, there are 3 vacancies with 1 new hire in progress. Admin fiscal, there's 1 vacancy, and legal, there are no vacancies. And I'll make sure Jana puts this in the notes for you to have. And that's the end of my director's report.
Have any questions for the director? All right, next we have items for decision. Adult in-home services bid approval.
Hi, my name is LaToya Heath. I'm in-home services supervisor, and I'm standing in the absence of Candace Franklin. So she's on the agenda, but I'm going to speak to the bids. In consideration of all 3 bids, we scheduled interviews with each agency, and those interviews were completed on April 23rd. After the interviews and at the direction of our director, Ms. Rochelle, we reached out to the lowest 2 bidders to see if their agency would be willing to negotiate the rate. Bayada was willing to accept $21 per hour for 3 years versus their initial bid of $22 for the first year, $23 for the second year, and $24 for the third year. Interim was unwilling to negotiate to a lower rate and remained at $21 per hour. At this time, our recommendation would be to continue our current contract with Bayada for $21 per hour for the duration of the 3-year contract. This decision is made not solely on the basis of finance, but to maintain continuity of care for our current client caseload. Remaining with Bayada allows the client to retain their current aid and the relationships that they have built with the current agency and staff over the past 3 years. And that's our recommendation.
So we would just need a motion to allow the director to execute the contract.
So moved.
Second.
Okay. Very good.
Thank you.
Thank you.
Thanks, LaToya.
All right, next we'll have board member comments.
I'm excited to hear about what you all are doing in foster care for Foster Care Month. I know you all work really hard over here, and like you said, partnerships are key. So thank you for the hard work that you're doing over here. All programs, but especially since it's Foster Care Awareness Month, just thanks to all that you're doing with your team.
I'd like to say thanks to the families and the homes in Pitt County that will take children that need a home, and it's I know it's gratifying work, but it's also difficult work. So, but thank you for all you're doing too.
Yeah, likewise, I would like to thank everyone that's involved with the foster care program, from the DSS employees to, as Catherine said, the families that support the program. I also would like to reach out to you, Rhonda, about the Links employment services, just to see where there might be some connections there. Thank you.
Just need a motion to adjourn.
Motion to adjourn?
Second? All in favor?
Aye.
Aye.